action. Hi guys, welcome to Shine with Nyoki Kamanja Kevi. Thank you so much for always tuning in. So today I'm going to be introducing a very interesting video because we have been talking about addiction and we have been hosting a very good addiction counselor who has been taking us through the journey of how the addict goes through a rough time and making us understand how to give them grace. And in the last video we talked about addiction as a family disease. Most of us have always thought that addiction affects the addict himself, but it also affects the family. So now in the next video he's going to be helping us to understand the stages that this person goes through this time when he has gone to rehab or he has been taken involuntarily. And I am going to be asking this question: is it okay for people to be taken to the rehab involuntarily? So stay tuned as we connect with our counselor. Welcome.
Thank you.
Leo umepiga casual. Na naona uko na nini brand?
Sio kupenda ni kujipata.
Ni situations. Yeah, you are taking ownership.
Situation. It's not opaque. It's transparent.
Say hi to your people. And introduce yourself just in case we have a new subscriber.
Okay. I'm Jafet Morimi-Gedenji. I'm an internationally certified addiction professional. I'm also an addict in recovery. Currently, I'm working in this brand. It's called Genesis Wellness Treatment Center. Frankly, it's the best treatment center in East and Central Africa.
The north of Limpopo.
North of Limpopo and south of Sahara.
Yeah. And
we treat various types of addictions and various comorbidities.
Wow.
So you're welcome to work with us. You're welcome to bring your loved ones. You're welcome to come yourself so that you can enjoy better and improved quality of life.
Wow.
Thank you.
You said
comorbidity.
What is that?
Comorbidity is a situation whereby a patient or someone has one or more conditions. For example, you have addiction, which we call substance use disorder, comorbid with another mental illness. Maybe major depressive disorder, which is commonly known as depression. Maybe you have bipolar mood disorder. Maybe you have schizophrenia. You have another medical condition, comorbid with substance use disorder.
I understand now.
Yeah.
So in the last video we were talking about addiction as a family disease.
Yes.
And you really helped us to understand that addiction is not only affecting the addict.
Yes.
It is also affecting the family.
Yes.
And when we were doing your story, you told us that you were taken to the rehab involuntarily.
Yes.
And I was asked, and most people say it's not good, even when people are seeking for counseling, if they are going through stress, anxiety attacks, panic attacks, to force them into counseling or into treatment.
Yes.
Why are we forcing them? Why don't we just wait for them to decide if they feel their life is not going the right way?
Yeah. Number one, I'll try to explain this in very simple language.
Yeah.
Addiction is a mental illness. Addiction is basically a situation whereby somebody cannot do without that particular substance. Their life revolves around that substance. That substance gives them happiness. Asking them to give it up can be sometimes tasking.
Yeah.
The Kenyan law, there's a specific, we call it Mental Health Act. It states that if a person is deemed to be a danger to themselves or others, they can be taken for involuntary treatment as long as also a doctor, a certified doctor, is involved who will give the diagnosis. But that is the law and the medicine. But look at it this way: suppose you find your loved one on top of a tree committing suicide, and now he's there dangling on the rope. He hasn't yet died. Do you start asking him now, nani tukate kamba, or do you kata the kamba, or unakata kamba kwanza kesi baadaye? If akikupiga juu alikuwa anataka kukufa, that is another thing. But at least you say
saved them.
you cut the rope.
Oh,
So that
okay.
is what we do. We cut the rope. Of course, we encourage voluntary admissions, but in cases whereby you see this person, if they continue with the behavior, they might die.
Yeah.
They are harmful to you. If they go use drugs and come threaten your life, will you still wait them to go to
volunteer?
voluntarily walk into a treatment center?
No.
That may not happen.
Okay.
So the law provides for that, and also I think common sense.
Yeah, because I had seen somebody saying that it's not good to take somebody if they haven't decided, and I don't know why I didn't connect with it, but also I said I do not know the law, and it's good to confirm. But you have confirmed that in the law it says if they are a danger to themselves or to the people around them, then it's okay.
Furthermore, you mentioned, I repeat myself, I was
Yeah.
an involuntary admission.
Yeah.
If my father would have waited until I accepted,
And you can see the
I'd be
results.
dead today.
Yeah,
but you
it's
see,
true.
the mind is sick. So if you are taken somewhere where the mind is healed and you are able to start thinking like a normal human being again, you have a chance to make a better decision.
It's true.
Thank you.
Now this addict, the family has decided to take them, or they themselves have just sat down and they have seen, I can't continue living this life. What are the choices that they have?
Okay.
Yeah, so that they can start the process of recovery.
It's usually very tricky for someone out there, especially a family member. And we have seen family members in this. I mentioned, I've worked in another country in Africa, and it's the same all over. By the time people come to us for treatment, they have tried everything. I'm not saying it's wrong. They try, wanaitia mtu chama ya wazee, wanaitia maankles, aunties, wanatoka hapo wanawaitia mapastors, wengine sorry to say wanaenda kwa wachawi. But coming to a professional will be able to do something we call screening. You know, because sometimes you find that people assume, or people put a label before they know the facts. So the addiction professional has tools and has the knowledge to use to screen and establish the severity of this person's addiction.
Okay.
And you'll find that sometimes even some of them don't need rehab. Based on the screening results, some of them would need this brief intervention or even outpatient level of care. And for those that the severity has reached a certain point, we recommend rehabilitation. Some even are able, after screening, and you recommend them to various 12 steps programs. 12 step programs or support groups include Alcoholics Anonymous, Narcotics Anonymous. They are a fellowship of people who are struggling with the same problem, and we find that it works.
Yeah.
Yes.
You've said that there's screening and assessment.
Yes.
How is it done?
Well, for screening, there are various modes of screening. First of all, the first step of screening would be to do a drug test. This is to establish the drugs that this person has been using. You know, normally we do a urine test or a blood test where applicable. Sometimes for voluntary admissions or even for involuntary, you don't need the physical test because the person is already saying, mimi natumia bangi nini. So after that, there are what we call now other tests, other screening tests. These tools are interview-like. They are set of questions that we, the professionals, are trained to ask, and based on how you answer those questions, and there is a scoring, I'm able to pinpoint, or I'm able to see the severity of addiction. There are various tools, and they are all certified, some by the World Health Organization, some by other institutions who have been there before us.
Okay.
Yes.
Now, you have screened, and you have when we were speaking earlier, you were saying that there are those who will need outpatient and those inpatient.
Yes.
Sessions.
Okay.
The process of treatment, what are the various types and levels of treatment?
Like I mentioned,
Yeah.
the various types of treatment, there's the brief intervention. If we establish that the severity is quite low and manageable, we just do brief intervention.
Brief intervention, you mean by maybe counseling?
Yes, counseling, outpatient counseling. Maybe you don't even need detox. We just need to find out, do further assessment and find out what was making you drink or do drugs, and maybe if we can be able to bring some of those things to light or solve some of the things that were making you drink or do drugs, you may have a shot at sobriety.
Okay.
Yes. And now there's the level of care, the inpatient. Inpatient now is rehabilitation. Yeah, this is where you come in, and the first step in that treatment, or in both actually, is detoxification. Detoxification basically,
it's like flushing out
the drugs. And before I forget, in the screening, we are also able to screen whether you have other comorbidities. You have other underlying conditions. So now in assessment and in continued treatment, we are able to see how we can balance medication, which in our terms we call it pharmacotherapy, which is done by doctors and nurses, and as counselors we do psychotherapy. So the nurse and the doctors will do the detoxification and any other chemical treatment of underlying conditions. And then you'll come to us, the psychotherapists, where we will do the psychotherapy part of treatment. This is where now we delve into your issues. What happened? What went wrong? How we help people learn ways to remain sober. We help people learn coping skills, life skills. We help you go back into your childhood and see what maybe went wrong, and things like those. Yes.
So now there's the process of recovery.
Yes.
Because this person now has been detoxed and they are starting a journey.
Yes.
And the journey is to recovery. But I remember you telling me that nobody recovers. They are called
we are recovering.
Recovery.
We are all recovering.
Yeah. So there's no like a day you say sasa nimefika.
Yeah.
So this the process of recovery.
Yeah. Let me, before I start explaining the process of recovery, let me give you a fact that many people who struggle with drugs, deep down, wanatamaninge kuacha, wanatamaninge kukaa sober. It's only that they
actually,
don't
there
know
are people
how.
who say every day this is my last.
Yeah. I remember there's an episode where we did the vicious cycle of addiction.
Yeah.
And at one point in the vicious cycle, there's somewhere people say, this is going to be my last. I'm not going to do again, only for the cycle to start again. Now, the purpose of treatment is to break that cycle. The process of recovery. Once now you've started taking drugs off your system, it starts at the withdrawal phase. The withdrawal phase is a very uncomfortable phase. There is a principle called Tita-Tota principle.
Tita-Tota principle. Me, I'm a good person. I learn things very fast. I'm a quick learner.
Tita-Tota principle. What comes up must come down. So if the drug was making you feel happy, if the drug was making you feel excited, if the drug was making you excited, if the drug was making you maybe it was shooting up your libido, or whatever it was doing for you.
Yeah.
Once it is not there, the
Like
exact
Fukushima.
opposite will happen. So it is uncomfortable. It is filled with a lot of anxiety. For some drugs, it's painful. For alcohol,
Hallucinations.
yes, people experience hallucinations. Yes, for example, hallucinations is a withdrawal symptom of alcohol. Others have tremors. For those who use marijuana, may experience severe anxiety, feeling depressed, feeling like they are not themselves, restlessness. For every drug has its own set of withdrawal symptoms. So there is the first phase of withdrawal which you will experience, and which you will be asking yourself, now what will I do without drugs? And mind you, that is why some people are unable to beat addiction, because they try it by themselves at home. So mtu anakaa nyumbani na anaambia bibi yake, leo I swear to you I'm not going to drink. So that night they actually don't drink, but what happened? They have restless nights, they have sweats, they have the hallucinations, and they say, you know what, I better go
And drink.
drinking. So treatment, whether outpatient or inpatient or whatever, helps you through that phase,
Okay.
because there's medication for withdrawal. And by the way, withdrawal from alcohol can kill. Yes, it is fatal. It is deadly.
More than the other drugs.
Not to quantify,
Okay.
not to quantify. I just want to put it out there, because have you ever had people like anasikia haja kunywa, anasikia ni kama atakufa? It's because the systems are shutting down, literally. So that is that phase, the withdrawal phase. Then after the withdrawal phase, now the withdrawal symptoms are over, there comes a very good phase which is called the honeymoon phase. Hey, and the person will feel nice. They will feel,
I'm beating this.
I'm beating this. Remember, this will happen regardless whether you are in rehab or at home or whatever. You've safely withdrawn for maybe 2 to 3 weeks, 2 to 4 weeks. Then after that, your brain is rewarding itself with a lot of dopamine, and you're feeling this energy that you've never felt before. The honeymoon phase. Now the problem is with our mind, and I think I've talked about this a lot, with our mind, nothing really goes away. So after enjoying that honeymoon phase, and now the chemicals in your brain are trying to balance and adjust, because you've starved them of what you used to use and your continuous thought, things start coming back to you. Maybe the things you did, your shortcomings, the pain from the past. Remember, during the withdrawal and the honeymoon phase, you've not had time to deal with your issues. So if your marriage was broken, it is still broken.
True.
If you didn't finish school, you still haven't gone back to school. Because between the withdrawal phase and the honeymoon phase, we're talking about a month and a half. So you've not really solved any issues. So those issues start coming back, and you hit a wall where you feel like nothing is working. And some people feel even staying sober is not worth it, because at the end of the day, you're still feeling shitty about yourself, you're still feeling bad about yourself, you're still feeling. But I want to let you know, it is a stage. It is your mind adjusting, and now all of those things are coming back. So at this stage, what somebody should do now, instead of, this is a very tricky stage. Unfortunately, on your timeline, 1, 2 months, 3 months, at around 3 months ndio watu wengi kwa wakitoka rehab. So wanatokanga rehab wakiwa wall stage.
That's why most of them are from the rehab straight to the bar.
Yes. Why? Because they are feeling. But now, if you come to me, if I'm your counselor, I will train you. I will tell you it is coming. I will tell you the whole stage will come, and sometimes it comes on and off. You see, and when I'm talking about anything psychological, even grief, any stage that involves the mind, see ati kama stairs za ati unapata step 1, step 2. Sometimes it goes coming back. So you might hit the wall stage, then you're in the wall stage for a few days. enjoy some honeymoon world stage, but basically hii ni ile stage now sasa ya kujua where you need to put in work in your life, where you need to, you know, to panel beat your issues. This is where now counseling is very important. This is where now support for family members, from family members is very important. This is where now going for AA, Alcoholics Anonymous, and those support group meeting is very important, because there you'll find people who have been in the world stage before. They might not have that name for it, but they know what you're going through, and you'll have skills and ways to go through the world stage.
Okay.
Now, the world stage is also characterized by a lot of cravings, because with all that pressure, you feel a lot of craving. When you're done dealing with the issues, you begin having a sense of stability, because you are able to use the coping skills, you are able to deal with the issues of the past and of the present as sobriety continues. Like I said, sobriety is a journey.
Yeah.
Yes, but before we get there, now even through the first stage, now this one is not only for the person struggling with addiction, even for the person trying to change anything. Remember, this person is trying to change from drugs to a sober life. There are people out there who you want even to change simple things like changing a vehicle.
Yeah.
But unashindwa hii nitaachilia na hii you feel a connection. Exactly. Yeah. So I'm very fast going to outline the stages of change that a person passes through. So the first stage of change is the pre-contemplation stage of change. This is where hauoni haja ya kuchange. Now most people struggling with addictions are there. They don't see the need of changing. Now, pre-contemplation. Then when some, maybe people put the idea into your head, before you even get to that point where your life is changing, there is a process of change or stages of change that you go through as a person. Now, this is not only for the people struggling with addiction. Yeah, you could be trying to change your vehicle, you could be trying to change a house or anything. Yes. So the first stage is pre-contemplation. Pre-contemplation is where now you don't see the need of change at all. Hata ukiambiwa inapita tu.
Unaniuliza njuu ya why?
Unaniuliza njuu ya why? Playa.
Na playa maisha.
Exactly. Yeah. So if you still waiting for the person to make a change and go to rehab, they might die in pre-contemplation. But the second change, mind you, we are trained to help people journey through the stages. That's the beauty of consulting a professional. So the second stage, is contemplation. Contemplation is whereby
the second stage, the first stage you said is
pre-contemplation.
Oh.
You are not contemplating change.
Okay.
Contemplation, you're contemplating, unasema, maybe I can, maybe I cannot. So there are things that are pushing you to change, but there are still things that are holding you back. We call that ambivalence. So at this stage, we help people resolve ambivalence. Now after contemplation, people start preparing for change. We call it the preparation stage of change. Now after this is where now you gather resources. You have not yet executed the change. If it's a car you are selling, you started gathering how much it can go for, how much a new car can cost. So the same with drug use, you are now gathering resources to help you in your recovery. Then you go to the fourth stage, which is action stage. Now the resources you've gathered in the preparation stage, you are able to use them in the action stage. Then there is a fifth stage, which we call the maintenance stage. Because again, if you don't maintain that change, what will happen? You relapse. You go back to what you are using. Now, for us in treatment, we also focus on relapse prevention. You see that utakuja pale umalizane na sisi for the number of days you'll be with us, or for the number of times I'll see you in sessions, and then
off you go.
Off you go. We have to do follow-up.
Yeah.
We have to do aftercare to try and maintain the change you've hopefully made
Yeah.
in your life.
Yeah.
Yes, and I think this is a good time to outline maybe
how to prevent relapse.
Even before you prevent relapse. Yes, it's good to say how you prevent relapse. Relapse prevention is basically, number one, you have to know your triggers. You have to know what could trigger you, so you have to know how to keep away from triggers. You have to have coping skills. Yes, you have to have an elaborate plan, a recovery plan. You have to have something you are doing. You cannot be in recovery and you are idle. Yes, you have to have did I say a support system?
Okay, you didn't say it, but
yes, yeah. It's there, a support system, an elaborate support system, whether it's us professional family members or anyone around you who can help you with your recovery. Number 6, you have to have things you are going to do that are going to replace your addictive behaviors. These are positive things. For example, hobbies. You have to have somebody you can call in case you feel like you want to take the drink. And that, I think, pushes me to the point, how do you know when to call somebody or when to do something about it? Just like recovery, just like we started, even addiction had stages, recovery had stages, even relapse has stages. The first stage of relapse, even before you pick up the drink or the drug, is emotional relapse. Emotional relapse now is whereby people start becoming irritable. They start, isolating yourself. Maybe throughout your recovery or for the time you've been sober, you've been able to open up, you've been interacting with people, you've been managing your feelings well, and now all of a sudden your feelings are all over the place. That pushes you to the second stage of relapse. Remember, you have not yet picked the drink. Second stage of relapse is in the mind, because the mind never forgets. So your feelings are all over the place and your mind remembers the thing it used to take to feel nice. So you start thinking about the drug. You start fantasizing. You start obsessing. And now the third stage of relapse is sasa you find the person actually now taking the drink or the drug. So knowing who to call or what to do before you actually pick the drink. It's normal when your feelings are all over the place, but knowing what to do, who to talk to, what the techniques and the skills you can use at that stage is very crucial to prevent relapse.
Wow.
And that, my friends, is the journey of a recovering addict. It's, for us, it's a cycle we have to repeat
every now and then.
Every now and then.
Okay.
Every now and then my feelings will be all over the place. I have to do something about it. And if I don't, I start thinking about drugs, and if I don't do something about it.
And I think one of these days you'll come and help us to understand how to deal with anxiety disorder and panic attacks.
Yes.
Because when we were talking behind the scenes, we noted that it's a very major thing to people. And most people, I think right now, when we're in a political heat, people are understanding what is anxiety.
Yes.
There was a day we were anxious as a country.
Yes.
Everybody was saying, naenda choo mara 10, sielewi, watangaze tu. So I think you'll help us to do that episode so that we can understand. Personally, I know what is anxiety. And maybe that time I might say something about it.
Thank you.
Thank you so much for helping us to understand, and we continue extending grace to those people who are going through this process and praying for them that place where they can be like you, who is even helping other people. And thanks to Genesis Retreat and Wellness Center for always helping you to come.
Thank you.
Yes, so we are grateful. Thank you, Genesis. And for you who have watched, remember this is Shine with Njoki Kamanja Kethi. You're the light and you can shine.
Shine with Njoki Kamanja Kethi.